Hi, my name is John McGuez. I am the owner and therapist for My Hope Therapy Services in Summit, New Jersey. We're going to do a video on progressive muscle relaxation. I did one a few years back, can't seem to find it, so I decided it might be helpful to do another one. Progressive muscle relaxation was developed in the 30s. I believe that's true. If not, it was a while ago, around that time. It's used for anxiety, it's used for insomnia, it's used for pain. It's also used within the context or within TIP, which is a DBT skill set that's used for when we're feeling very, very distressed. You know, think about a scale of 0 to 10, 7, 8, 9, 10. So this progressive muscle relaxation exercise uses PMR and mindfulness together, which is a little different than what might be available online. So if this doesn't really work for you, you have a bunch of other options. I mean, you Google progressive muscle relaxation, you'll see a million ways to do it. Typically, progressive muscle relaxation is done from the bottom up. We're going to do it from the top down. So when we're doing progressive muscle relaxation throughout the exercise, I'm going to ask that you just focus on the sensation of the tension and the relaxation. Really move away from, being attentive to your thoughts, move away from your emotions even, and just kind of focus on the physicality of the exercise. When I ask you to describe, you're just using facts to describe the sensation that you're feeling. And those facts could be a stream of one-letter words, they could be sentences, but you're essentially describing it to yourself. Again, you would use this for a variety of reasons. It's considered a relaxation technique. And it's one of the first things that we probably cover in most sessions with clients who are struggling with anxiety, pain, or some other form of high-level distress that interferes with their day-to-day life. So let's begin by closing our eyes and just kind of sitting in a way that's relaxed. I'm not going to do this. I'm going to talk to you about how to do this. And your eyes are closed, so it really doesn't matter if I do it. So we're going to close our eyes. And we're going to start with creating tension in our forehead by kind of pushing our eyebrows together. Distract away from whether you're doing it right or wrong. Distract away from how you look. And just notice the sensation or the feeling in your forehead as you're doing this, and notice the feeling on the left side of your forehead compared to the right side, and describe what's similar and different about the feeling on each side of your forehead. Now relax your forehead. Notice how that feels. Notice what's different about this feeling. Describe what you're feeling now and how it's different from the feeling before. Let's move to your eyes now. Let's squeeze them nice and tight. They want to hurt. You want them to hurt a little bit. Notice the tension in your eyes. Notice the tension in your right eye and how it's similar and different to the tension in your left eye. Describe what is similar and different about the tension in both eyes. Relax your eyes. Notice how that feels. Notice what's different about that feeling. Describe the feeling now and how it's different from the feeling before. Now move to your jaw, clench your teeth. Notice the tension in your jaw. Be mindful of how that tension changes from one part of your jaw to the next. Describe how it changes, what's different. Relax your jaw. Notice how that feels. Notice what's different about this feeling. Describe this feeling and what's different about it. Let's move to your shoulders and shrug your shoulders so that they're reaching for your earlobes. Notice the tension from shoulder to shoulder. Notice the tension, your shoulders, your collarbone, your neck. Notice how the tension changes from one part to the other, and describe the tension and how it changes. Relax your shoulders. Notice how that feels. Notice what's different about that feeling. Describe this feeling. Describe what's different about this feeling when compared to the feeling before. We're going to stick out our chest, having our shoulder blades meeting in the back. Noticing the tension in our chest and our upper back. Noticing what's similar and different about the tension in our chest and upper back, and describing what is similar and what is different. We're avoiding words like good or bad, painful. We're just describing facts. Relaxing your chest and upper back now. Noticing how they both feel now. Noticing what's different about how they feel now. And describing what's different. We're going to move to your stomach, and here we're going to use muscle, not air. Let's push our bellies out. Notice the tension in our stomach. Notice the shift or the change in our breath. Describe that. Describe the feeling in our stomach. Describe how our breath feels factually. Avoiding judgment. Just noticing and describing what we're noticing. Relax your stomach, allow it to collapse. Notice how that feels. Notice what's different about that feeling. Describe this new feeling in your stomach and in your breathing, and what's different about it when compared to how it felt before. Keeping your hands and your arms loose. You're going to create tension in both biceps. Notice the tension in your right bicep and how it's similar and different to the tension in your left. Describe what's similar and different about the tension in each bicep. Relax your biceps. Notice how that feels, what's different. Describe the feeling now and how it's different from the feeling before. Let's make two fists nice and tight. Noticing the tension in our hands, our wrists, and our forearms. Noticing how that tension shifts or changes as you move your attention from hand to wrist to forearm. Notice what's similar and different about the tension in your left hand when compared to your right hand, and describe what is similar and different. Relax your hands, notice how that feels, notice what's different about that feeling. Describe the feeling you have now and what's different when compared to the feeling there before. Now we're going to keep our heels on the floor while we move our feet to a 45-degree angle, and we're going to press down on our heels. We're going to notice the tension in our heels, our ankles, our calves. Notice the tension from heel to hip. Notice or be attentive to any changes in the tension as you move from heel to hip. Notice what's similar and different about the tension in one leg when compared to the other. Describe what is similar and different. Relax your legs now. Notice how that feels, what's different. Describe the feeling and what makes it different. We're going to take our toes We're going to curl our toes underneath our feet, noticing the tension in our toes, noticing the tension in our feet, noticing how the tension is similar and different in one foot compared to the other, and describing similar and different. Relaxing your toes, noticing how your feet feel now, what's different about that feeling, describing the feeling now, and what makes it different from the feeling there before. Slowly step out of the exercise and open your eyes. Given I have no short-term memory, I don't know if I mentioned, any part of your body that's in pain, you should probably avoid during the exercise. This exercise is, again, pretty ideal for when we're feeling stressful. You can do it at work. If you don't have an office, you can go to your car, or you can use it in the bathroom. I mean, that's not the most hygienic of places, but if you're really losing your shit and you need to do something, this is something that you can do. I'm trying to think, did I forget anything about progressive muscle relaxation? Oh, like anything else, I mean, so if you were feeling calm before the exercise, you probably didn't do it, but if you did it, you're probably not going to notice a lot of difference in how you're feeling now versus how you felt before. When you're feeling very distressed, usually you'll notice a pretty big change in the before and after. And I think that's it. If you have any questions, or if there's anything that I should have mentioned that I didn't, you can just write it down in the comments, and I'll try to respond or answer to it. All right, thanks for your time. See you guys soon.